Thank you everyone for coming. It's good to see so many people here. A lot of people don't understand what goes on, and I guess you're all insiders with looking at the issues of social enterprise. I think it's good to see this put together with the Nutrition Canada, with the Lead on Canada, with the Global Affairs, Maria Monsef from the Canadian government, and of course Mars here to talk and Grand Challenges, to talk about how you actually try to make change around the world. A nation can change. So that what you do is you actually, where you see the outcomes that you desire happening, then you can continue to fund it. It's kind of like the ultimate in accountability, making sure that you actually make a difference. And I think what is important about what is happening here, and this whole concept of social enterprise, as I know, the federal government has actually decided to put a great deal of money in this because we believe that we have to make change around the world. I think the federal government feels that it is really, really, our government feels it's really, really important that we don't leave people behind around the world. And, you know, I know we get criticized. A lot of people say, well, you should spend that money domestically, right? So the bottom line is you cannot move forward as a nation unless you bring other people along with you. And there's so many countries of the world that are struggling and that are suffering. And we see that this causes enormous issues that we're trying to deal with. Mass migration, because people can't feed themselves, environmental change, poverty in many countries, conflict. You know, we now have more people mobile around the world trying to find a place to call home and to live that is safe and secure and that can feed them and their families than we ever have in the history of World War I, World War II, and any other conflict put together. And this is all because of changes that are happening now, and we need to be able to deal with it. And so helping to move people forward, giving them the ability to stand on their own feet, to be able to build their own countries, to be able to, especially for women, whom a lot of money, historically Canada has spent on women, when the old seal was there and we would spend money on women, having women in social enterprise, and it was always found that when you helped women, in a village or wherever, you will always find that expands and that helps the whole community. But I'll never forget when I was Minister for Women's Equality, that I was in South Africa and I met the South African ambassador who was touring some of the social enterprise that we had been doing around South Africa. And he took me to this place, and this family, this woman, they had bought a cow with the social enterprise money. And they had started to sell milk in the little village itself. And then they became so successful that they bought another cow and they got milk, and then of course they were told as part of social enterprise to make yogurt and to do other things with milk. And then he had been a person who would work with Global Affairs at the time, and he came back many years later and visited, and he said, oh my goodness, you know, the place had changed. There was kids were going to school, there were schools, it was just such improvement in the whole village and in the surrounding villages who were now helping and sharing in the expansion of this enterprise. And he said, well, what's going on? And you have no problems, you seem to be fine. And they said, no, we actually need a veterinarian. We'll have all the cows that we have because they are we don't have anything to take care of them. So he said, well, what can we do to help? And one of the women said, it's okay, I married one. You want to talk about social enterprise and how women are innovative, how you can get things done. That was a fine example. And so I am very proud of how our government is moving forward, recognizing that this is a moral imperative, but it is also an economic imperative. It makes sense. And so I want to thank you all for being here, for allowing me to say a few words. I know you heard from Maria Monsef. I don't know if you heard her. She's a remarkable young woman. I think she brings a whole new dynamic to the issue of gender equality, looking at gender in the broadest sense of the term, or the intersectionality of gender, including LGBTQ rights. So this is something that we're expanding around the world, and this world is getting smaller and smaller. There's more xenophobia, and a lot of people are looking inwardly and nationalistically to say, what are you doing for me? Why are we not spending money from my taxpayers' dollars in my country? I think that I am proud to say, and I would boast, that Canada is leading the world in saying, no, he ain't happy, he's my brother. This is a very important thing for us to think about. And Canada has always done this, but I think we've just stepped up and moved the bar forward a lot with the commitment of our Prime Minister, who really believes and is a strong advocate personally of this kind of enterprise. So with all of the work that you're doing, and the partnering, and especially the partnering with public sector or the private sector, getting people in businesses to be able to banks, etc., to say, we have to put belly up to the bar. We can't just let this be done by government. We need to be able to do these. But the measurable goals and the measurement of success is a really key part of what you do on social enterprise. So it's my pleasure, without going on and on, as you know, the politician always goes on, to introduce Pauline de Clerc, who is Assistant Deputy Minister at Global Affairs Canada. Pauline.
I don't know what sort of coffee you drink to be able to generate so much energy. You defeat the shame. Thank you very much. Inspiring words. So, very well done. Thank you so much. Mon nom est Caroline Leclerc. Je suis ministre adjoint du partenariat pour l'Organisation de développement Affaires mondiales Canada. Et je vais en profiter pour souligner que nous sommes bienvenus aujourd'hui sur le territoire des communautés Squamish, Musqueam et Tsotho, qui nous souhaitent la bienvenue ici. Really pleased to be here for an event that's hosted by Grand Challenges Canada and Nutrition International, two of the gems in the ecosystem of international development organization in Canada. And with this opportunity to speak about three topics that are really close to my heart: partnerships, innovation, and money. And they're really enabling pillars of the Sustainable Development Goals. And in Canada and around the world, communities are facing dire challenges related to food insecurity, to human rights abuses, the lack of access to health services, to nutrition. And we know that women are disproportionately affected, and our collective hope for a peaceful, a prosperous, and a sustainable world are embodied in the Sustainable Development Goals. And in Canada, that's in the Feminist International Assistance Policy, where we strongly affirm and believe that empowering women and achieving gender equality is the best way to achieve sustainability and to eradicate poverty. And we know. Thank you so much. I can check my notes. It's the first time I'm doing this without a little collar. Yes. Thank you. I'm good at that. So we know very well that there's no one government, one organization that can achieve the SDGs on its own. We all have, I think, a moral imperative, a responsibility to help governments, civil society, investors, philanthropists working together hand in hand to get to 2030. It's all hands on deck. There's also an SDG about it. And we also know that there's no way government OTA is going to be able to get us to an additional $2.5 billion a year to get to 2030. And we also know that business as usual will not get there. We need to do development better. We need to do it differently. We need to innovate. And we need to innovate our policies, in our programming, and in the way we finance development. In Canada, we've been trying to build our toolkit to do innovative ways of financing development. We started with Convergence, and if you haven't heard about Convergence, go check them out. It's a global financing facility with our $1.4 billion innovative finance program. And just this week, we announced the Equality Fund, which is a new innovative platform. It's going to be a self-sustaining platform that's bringing together granting, philanthropy, and investment, all to support these organizations in developing countries. So we're quite pleased to be here, to have the opportunity to learn and share knowledge with all of you. And without further ado, I'm going to turn it back to Carly Silver.
So I feel like I'm going to take this home. So I'm going to welcome you all and just also echo my thanks for showing up on this Thursday morning very early after I know what's been likely 2, 3, 4, or 5, who knows how many days you've been going already here at the Mental Heart. I'm going to get our esteemed panelists up on the stage because I'd love to get us right into this conversation. So I am going to introduce to you Dr. Ratina Baye, who's our coordinator of Cameroon's National Program for Reduction of Maternal, Newborn, and Child Mortality, Ministry of Public Health in Cameroon. And Ratina is one of the fiercest champions of newborn health that I know, and it's been a real pleasure to work with her as we've structured this bond. Dominique Carey, who's the manager at Social Finance UK, who has that unique skill, set of combination of finance skills and soft skills needed to actually get something like a development impact bond off the ground. Emily Measures, who's the director at NLIFT at Nutritional International, and she's got some amazing deep expertise from living and working outside of Canada that she is bringing back to the NLIFT program now. And then Stephen Nairn, who's the Chief Investment Officer at Reagan Indigenous Capital Partners, who also has an interesting path of having lived and worked in developing countries for several years, and has now come back to Canada and has really dove into the social challenges that exist within our own country, and how the kind of skills he's developed can actually push us forward. So I'm thrilled to have this panel this morning. What we're really hoping to do is unpack some of what we've learned and what's ahead when we talk about innovative financing and specifically development impact bonds and their uses. So before I get started though, I would love to just ask a few questions. So show of hands, who has a good idea for how to make the world a better place? Yeah. Okay. Who's actually tested that idea to figure out if it actually has grounding? Yeah. Okay. Who has money to spend on evidence-based ideas? Cool. Who wants to see progress against specific social challenges? Yeah, I would expect everyone in the room to be saying that. Who's willing to actually take risks for the ideas and potentially not get your money back, potentially get more than your money back? Nice. Who really needs to show that every dollar you spend has a specific outcome attached to it? Yeah, okay, cool. So at the heart of what we're going to talk about is how do we pull these different people together from different sectors and optimize the right mix of what role each person is playing, so that where you put your hand up saying I need that or how I have that is actually what role you're playing within this structure. So at Career Challenges Canada, we're constantly innovating to bring multiple kinds of partners: private sector, public sector, civil society, academia, small medium enterprise together in order to address specific challenges. And while some of the innovations we fund actually do have revenue generating models and commercial paths to scale and sustainability, we actually had our first exit this year, which is exciting. So essentially a company paying us back, which is kind of a landmark for us. And while we don't expect that every time, that where there is profit to be made, we hope that the kind of investment we put in is actually paid back so that we can keep investing in the future in other new things. Lots of things that we've actually prioritized, though, don't kind of bode well for a commercial path. Things like early child development, global mental health, gender equality. These are really tough to make commercially viable, and for good reason. If you're looking at the most vulnerable, you're looking at third-party buyers for a lot of the stuff that is being put forward. And so we need new ways to think about how we are going to be crowding in these trillions of dollars that people keep talking about that are somehow floating out there, and that we haven't quite been able to attract into the space. But a lot of that has to do with the fact that what we're offering is not exactly where they're looking to put their money. And so this, and when we're also using a lot of grant funding, it's hard to hold innovators accountable for what they're hoping to achieve. The same way that Dr. Fry started, this concept of innovative finance can really bake in where the results are being achieved and how do we reward that versus just checking off kind of activities in log frame. So this is where a social impact bond or development impact bond might come in handy. And thankfully, our wonderful communications person at Great Challenges Canada, I think over here, put this thing together. You should have all had one on your chair. But it gives you a bit of a diagram as to what we were talking about with the development impact bond, and shows you the different places that people are playing. And at the heart of it is you've got a service provider who has something that has some evidence that it can have impact and thing you want to have impact on. But there's elements of it that are still being tested. There's still some risk involved in whether it's scaling it up or making it work more efficiently. And so in order to do this, you actually have an investor that is giving them the money to test this out and to do what they've promised to do. In this case, Grand Challenges Canada is playing this role, and the Kangaroo Foundation of Cameroon is playing the role of the implementation partner. And then you have outcomes funders, who in this case are the Ministry of Public Health in Cameroon and Nutrition International, who are really interested in the outcomes that are coming out of that, the Kangaroo Foundation's work, if it works well. And they're willing to actually part with their money if those results are achieved. And that money then flows back to Grand Challenges Canada, the investor, if there's success. So Grand Challenges Canada is incentivized to help the innovator succeed, because then we would get our money back. Both NI and the Ministry of Public Health in Cameroon are really aligned in terms of saying, like, these are important enough that we're willing to part with money on this once we see that there's results. And then really importantly, to be able to put us all together is the person who would structure this. And in this case, it's the Mars Centre for Impact Investing and Social Finance UK, represented by Dominique here. So that's roughly the flow of what we're going to talk about, and there's that nice diagram you can refer to. So about 4 years ago, it was still very early days for social impact bonds or development impact bonds. The only difference of those is kind of where they're situated in the world, to be honest. And we were really starting to look at our portfolio of innovations to understand which of them might be well suited to test out a development impact bond model. So we landed on the scale up of quality newborn care practice, this kangaroo mother care. So it's essentially when preterm or low birth weight babies are born, you put them, you encourage mom and dad preferably, to be holding the baby for as long as possible, skin to skin. This helps with retaining body temperature, with exclusive breastfeeding, etc., and actually has some amazing evidence linked to it about their long-term cognitive development abilities because of the way that the brain keeps developing much more similarly to how it would if it was still in the womb than being in an incubator. And so, while this KMC practice has a ton of evidence behind it, it's really been slow to take up in lots of parts of the world. And what we're trying to figure out is, how do we actually have an investment in something that can help kickstart this? And really to figure out, how do we get it into a system where the system has sufficient capacity, institutional memory about how to do this well, that it can be sustained. So that was our goal here, is how do we actually train enough of the places within Cameroon on kangaroo mother care so that we could actually see the huge evidence or impact that we were looking for. So really what we're going to do with the panelists we have today is to tell you a bit of the story behind this kangaroo mother care development impact bond that we just finalized. So remember I said we started this 4 years ago, just finalized it. So we've got a lot of scars to share about what happened along the way. And in some ways we kind of faced the worst outcomes of all these things while still making it happen. And so we can kind of tell you about how maybe the things to look out for, and also excitingly, how do we look to the next phase of these types of impact bonds or social financing mechanisms in a way that we can kind of overcome, mitigate, etc., avoid some of the challenges that we saw along the way in this. And this is not, I think at one point it seemed to be a little bit of a fad. We've now had the Canadian government put a commitment of almost $800 million behind this in the domestic space for social financing. And so this is something that is becoming more and more mainstreamed. I think Stephen and Doug can shed a little bit more light on really where the world is at on these things. And so with that, I'm going to dive right in. And I'm also going to sit down. Good, so I'm going to get Martina to kick us off here, and we're going to have to share microphones as we go. But so Cameroon is a leader in the space of in this space. We were the first government to be an outcomes funder in a development impact fund. And you're also a real leader in terms of newborn care and the kind of action plans in the world that have been behind that. So Martina, tell us a little bit about why this structure was attractive to advance the goals that you had and Cameroon had for newborn health in Cameroon.
Thank you, Karen. Good morning, everyone. I first want to bring greetings to everyone here on behalf of my minister, Dr. Manauda Mulashi, whom I'm representing here, and who is a great supporter of this project. He just came into the ministry about 6 months ago, and he finds this really attractive. So, as to why we are supporting, or we went for this approach, let me start by saying that Cameroon is one of those sub-Saharan African countries where we have huge challenges with maternal and newborn health. Our indicators are really worrisome and preoccupying. So about 5-6 years ago, Cameroon decided to kind of innovate in terms of healthcare financing by so as to improve on those indicators and other indicators by actually funding health facilities depending on how much results they produce. We call that performance-based financing. So you actually fund the health facility according to the results they produce. This of course is progressively being implemented. And then in 2016, when we got enrolled in the Global Financing Facility, we developed an investment case to improve on maternal and newborn child health, including nutrition. And of course, newborn care, which has been one of the areas where our indicators have been stagnating for the past years, is prioritized within this investment case. To say about the figures, Cameroon is a country of about 25 million inhabitants. We have about 800,000 pregnancies expected each year. And each year we're losing like 5,000 to 6,000 women because of the causes linked to delivery and pregnancy and childbirth, and about 22,000 newborns. That's unacceptable, and we decided to actually put an end to that. So that's how we started with this performance-based financing. So in the investment case, we decided to prioritize Kangaroo mother care, which, as Carly just said, is an affordable and effective tool for actually improving newborn survival. And during our discussions, when we were elaborating the investment case, we realized that there was something called the Development Impact Fund. And we said, well, this sounded like what we've been doing already through performance-based financing, and better still, because there's somebody who's ready to come in as an investor, invest and accompany us technically and make sure that we reach our results. So that's how we decided to come to embark on the deal. Now, when you're a government and you decide to go towards to change the situation, get certain results, and you happen to find a partner who's ready to invest, take the risk of investing, not only invest, but accompany you technically. And in the case of Cameroon, we actually benefited from, in the phase preceding the deal. We actually benefited from state-of-the-art, technical support from Grand Challenges Canada to start implementing Kangaroo mother care in our hospitals. And we could actually see the results, which were very, very significant. To tell you, the hospital that's going to serve as the training center for the others that are involved in the deal actually saw the level of newborn mortality during the first year drop from about 45% to 21% in just 1 year. So we're hoping to. I mean, that really got us attracted to this approach, because we know not only is the partner investing, but it's a partner we know who's coming up with all this technical support. And of course, as a government, we know we only spend our money when the results are reached. So that's why we decided to really support the team. And I think I should really thank all those who contributed to us getting to this stage. Started 4 years ago. Many people were involved, and here we are now, finally starting to implement. And we're looking forward to really reaching these results or replicating the results we have found in this mother hospital to the other hospitals. We have 10 hospitals that will be involved in this team. 8 of them are like at the referral level, so they're going to at the later stage serve as mentors for the low subnational hospitals. So that's why we think with this Kangaroo mother care being implemented through the team, it's really a new era that's coming on for newborn care in our hospitals. And personally, I believe, things will never be the same again for our newborns.
That's great, thank you. So Emily, Nutrition International is our other outcomes funder in the structure, and I'd love to hear. There's just a few differences between, Ministry of Public Health focused on newborns and an international organization focused on nutrition. Why was this also an attractive thing for Nutrition International?
Great. So, yeah, thanks, Carly. So for those of you who may not be familiar with Nutrition International, our key mandate is to deliver low-cost, high-impact nutrition interventions. That's really our starting point. And so we really saw this as an opportunity to work in partnership with the government of Cameroon to really move the needle on newborn deaths. We know globally 2.9 million babies die in the first 4 weeks every year. 99% of those deaths are happening in low and middle income countries. As Dr. Bay has just said, 22,000 deaths a year among newborns in Cameroon. And that's unacceptable because we know how to prevent those deaths. And one of the low-cost, high-impact interventions that we know is Kangaroo mother care. And as Carly explained earlier, this is an evidence-based intervention. It has 3 main components. So skin to skin with the mother or the carer, ideally for between 8 and 24 hours a day. Exclusive breastfeeding, and early discharge and timely follow-up. We want the mom and babe back in the community around her support networks, but we want to make sure that she's coming back to the hospital and getting the care that she needs. With those interventions, we can see a 40% reduction in early deaths among newborns. So this was our main focus. How can we work with the government to implement this intervention? But there are barriers to scaling KMC. To implement quality KMC, it requires that all elements of the health system are functioning, and that is difficult. You need to have the staff in place with the skills, and those staff need to be motivated. You need to have the right supplies and equipment, and that they are in the right place, that they're not locked away in some cupboard, but they are there at the point of care. You need to have the right leadership at the facility, the policies, the protocols. And you also need to be able to collect data to inform your interventions and to know whether what you're doing is working. So we at Nutrition International really saw the DIB as an opportunity to accelerate implementation of a known evidence-based intervention. The DIB provided the upfront capital to invest in infrastructure and training. It incentivized performance at the facility level. And what was particularly exciting for us at Nutrition International was the fact that we were sitting at the table with the government of Cameroon as an outcomes funder. So we had their ownership, their buy-in, in order to ensure the sustainability of this intervention. I think a second motivating factor for us was really how do we get the most nutrition for our money? And that's really something that as I with Nutrition International, we've really been thinking about is, how can we stretch out our dollars to have maximum impact? And this was a really exciting and innovative way for us to do that.
Great, thank you very much. So before we move on to our more finance folks, I wanted to just ask Martina and Emily both, this is not a simple structure to sell internally. I think one of the things that Dominique will probably refer to is that there's a lot of education that's required for any of the institutions that are involved. Luckily, we had, as Martina mentioned, a government that was already used to the pay-for-performance model, so it's a kind of small jump from that. But maybe you can tell a little bit about who were the kind of hardest to orient towards this within your own organization or departments, and what was it that they were really struggling with about this development impact bond?
Yeah, yes, because the performance-based financing was there as something to facilitate understanding. And I remember the first time, I met with my minister, former minister, this is 4 years ago, to talk to him about this approach. He was like, is it like, what is the difference between this and performance-based financing? I said, sir, it's almost the same thing, and much more. In this case, you keep your money until the results are, achieved, you're sure, verified, and then you spend. So then let's go for that. So
there are rational politicians.
So we had the minister's support right at the beginning. And of course, we had to work through all of this with colleagues, and it wasn't easy. First of all, getting into the unknown. Colleagues were like, are you sure we'll be able to find someone who's ready to take the risk of investing and not having, their money back if results are not achieved? Are you sure this will really work? We need to change, we need to move on with our indicators. This is taking too long to prepare. When will this thing ever start? So, and then of course, we had to work with ministries, administrations other than the Ministry of Health, because when you start talking about the return on investment and so on, you have to make sure that the Ministry of Finance is knowledgeable about what we're going to do with this money that we had, of course, from the global financing facility, but of course, it becomes like the public product. So we had to work through all of that, and our role, me and a few others, was really to hold the hands of our colleagues at the time. And thank God we had had the experience in our mother hospital that continued so that it worked. And we knew that during the day we would work with the same partners and we were sure that we would reach results.
Yeah, great. Thanks, Carly. So I think from Nutrition International's point of view, we were really interested in the quality aspect of the intervention. We wanted to know not only that the KMC was, that the service was ready to implement or deliver KMC, but actually that that's what was happening, and that it was a quality KMC that was being delivered to moms and babies. And so there was a lot of discussion from Nutrition International's side around how can we incorporate metrics in order to be able to measure that impact. And there was a lot of discussion, and perhaps just to go through the 3 metrics upon which this DIB is paying out for results. So the first metric is really around service readiness. Is that particular facility set up in order to be able to deliver KMC? And we have a predefined checklist that we use in order to be able to assess that. That's looking at infrastructure, equipment, staff, and policies, all of the kind of building blocks that I was talking about earlier that need to be in place in order to deliver this intervention. But we really wanted to dive deeper, and we wanted to be able to ensure that we were seeing an impact on infants' ability to survive and to grow. And so the second metric tries to pick up on that and looks at the number of newborns that are receiving quality KMC up until the point of discharge. And we do that in two ways. One is through checking facility records, looking at when they were discharged, birth weight at discharge, and a few other indicators. When our independent verification agents go to the facility, they are also then interviewing mothers and asking mothers to explain the KMC process so that we get a glimpse into the knowledge that the mothers have around KMC. But the additional metric there is around observation. So the verification agent is actually watching the moms deliver KMC to their babies. So that's the second metric, and that's how we're really trying to get at that quality aspect. The third metric is around the weight of the baby at that follow-up visit. So as I mentioned, the third component of KMC is to ensure that the baby comes back at 40 weeks and has achieved a specific target weight. And so again, we are looking at that metric, and there was a lot of conversations around, what if the baby is discharged at this weight, what does it mean to have had an appropriate weight gain? Because we don't want baby to gain too much weight or not enough. And so there was a lot of conversations that were happening amongst our technical team and with our partners here to really set those targets so that they were achieving the outcomes that we want. And so I think that for us was the key challenge around this.
That's great. So I'm going to switch gears a little bit and turn to Dominique. And it's obviously you're getting glimpses of the journey that we've been on to launch this bond. And I'd love, Dominique has structured many bonds already and still ongoing, many different ones. So we'd love to hear from your standpoint, what were the biggest challenges that you saw us face and that you were alongside with us for, and give a little bit of color as to how common those are, or whether this was kind of a unique situation for some reason.
And a moderator, feel the opportunity to ask questions.
Absolutely. Don't worry.
I'll try to be quick. So it won't surprise anyone on the panel if I say that I think the main challenge was around fundraising. So we had to fundraise on both the outcomes funder side and the investor, because as Carly mentioned, GCC was the sort of anchor partner at the beginning, and then we brought in, the government of Cameroon and Nutrition International. So that process went relatively well, but it does take time. What was a lot more difficult was around fundraising on the investor side. And I think part of that is specific a bit to this program, in that Cameroon is not a priority country for a lot of donors and investors. That being said, this is a sort of general issue, I think, in the space. And it's due to a couple of things. One of them, I would say, is that it's a lack of education, as you were mentioning. It's new for a lot of people, so it takes time for people to really understand what it means to actually be part of an impact bond, whether that fits with the strategy, which role are they going to play in the impact bond? Is it an outcomes funding role or an investor role that actually fits best? And if they do want to actually be part, then how do they do it? And the internal processes are very sometimes tricky to navigate for some organizations. Some are more nimble than others. And generally, I think doing the due diligence does take time for any investment, and that meant that for some players, actually, the size of the deal was not large enough to justify this initial sort of investment into the due diligence, but also the contracting process. And I would say also there's something interesting in that as soon as you talk about an investment, even for organizations that are making bonds where you're sure to lose 100% of your money, suddenly there's a risk management cap on where they actually do a lot more due diligence than what they would be doing, with the grant approach, which I find very interesting. But this is a sort of ongoing issue, which I think will become easier and easier as more people sort of get their head around what an impact bond is and how to navigate the process. And related to that, actually, contracting has been another challenge, and I think generally that will continue being, complex in general. But I think at this stage in particular, not many organizations have had the opportunity to do it, so they don't know how to navigate internally their own processes to make this happen. So once we have the industry, more organizations actually doing this kind of, using this kind of instruments, I think we can hope that there's a sort of bureaucratic precedence being set, and so people will know what type of contracts to use, what clauses they're interested in putting into place. But in our case, we had to sort of start from scratch, a whole sort of contracted template, which took a lot of time. And actually, we're working currently on another impact bond where, with the launch, bilateral outcomes funder, which has already done a couple of impact bonds, and so actually this is going a lot faster. We started the design this year, and we're sort of hoping to launch it later this year. So that bit, I'm sort of hopeful that it will get a bit better. Another challenge that I want to mention is around disbursement deadlines. I think that has been a bit of an issue in this project, and that will continue being a general issue in the space. I think all organizations actually have disbursement deadlines on the funding that they were committing towards the program. It's not an issue for the investor because they put the money up front, but obviously for the outcomes funder, we need to wait a couple of years to pay based on outcome. That is an issue. And because the value of an impact bond comes from actually having the time to iterate, to sort of adapt the program and figure out what's the best path to actually achieving these outcomes. If you're suddenly struggling to have several years to actually have space to have that adaptive management put in place, it's not as ideal. So in our case with GFF and Nutrition International had deadlines, which meant we can't have a 5-year program. It's shorter. Sorry, can I have the last one? I think the last interesting one is around the sophistication of the Kangaroo Foundation Cameroon, which is our partner. It's a very young organization, and I think one of the key issues we faced was around the data collection and the data that we had available. And I think that's a general sort of issue maybe in developing countries, but in particular, some organizations have MIS and processes that allow at least a lot more information. So the pilot that Martina mentioned that GCC has financed was really helpful, but I think it was still an interesting process to understand what was the right target, the right outcomes, and what GCC was comfortable as an investor to take risk on.
Excellent. So we're going to pull it back into the Canadian context now and turn to Stephen. And Raven Capital has been applying these kind of pay result structures and things within Indigenous communities. And so tell us a little bit about that, what's working, and how you've adapted this to be most appropriate.
Thanks very much. So Raven Capital Partners is an Indigenous social finance intermediary. We were headquartered here in Vancouver. When we set up a couple of years ago, the initial focus was on providing investment readiness and capacity building to Indigenous social enterprises and the establishment of a purpose-driven venture capital fund, which is now operating. But we very quickly realized that if we wanted to address some of the underlying systemic issues that we needed to begin exploring these results-based financing mechanisms. There is, however, an underlying problematic in the Indigenous space, and as we move toward reconciliation. And to summarize, the problem is with the public commissioner, in this case, a provincial or federal government, identifying and pricing outcomes. And so the adaptation we have made to that, we call it community-driven outcomes buying contract, is that we go through a 3-step process that begins with very intensive community engagement, and then we move into what we call a solutions lab. And finally, then we move into structuring the sort of results-based outcome contract where the communities themselves take a leadership position in defining the pricing of those outcomes. So we are nearing completion of our first community-driven outcomes contract, which is in the renewable energy space in Manitoba. This is on reserve related to the installation of residential geoexchange systems. And there are a variety of environmental and social outcomes that we have arranged. And talk a little bit about how the main part is structured there. And the second one, which we think is even more exciting, in the area of diabetes prevention and management. The prevalence rates on reserve are upwards of 40 or 50%. These are not people who are 50 or 60, they're 20 or 30 years old. And so we're gradually moving through that process, and we hope to have that up and running here in our schools.
So I'd love to just hear from both Dominique and Stephen. You hinted a little bit about how you're already changing some of the structures of the traditional kind of civ model, but say a little bit more about where the future is going around these types of impact bonds and how to solve some of the problems that Dominique was raising there.
Sure, so we've been spending a lot of time in social finance trying to think about that, and we're also playing the role as a secretariat for an impact bond working group, which has a website online, so if you're interested, do go see it, which is basically sort of government-led group that is thinking about how do we actually scale those outcomes-based approaches. And I think the two key barriers that we've identified is around, okay, there needs to be more money actually in that scale being flowed through this, and that starts with a pipeline of projects led by outcomes funders to then get the investments really flowing into it, and then a whole knowledge aspect to it. So there are a couple of outcomes funds that are currently being worked on by various players in the industry, which would aim to basically pool funding at scale towards outcome, and which would basically help commission several contracts, several projects, rather than being one project at a time. So that would, facilitate a bit the sort of commissioning process, the contracting process. It would also allow for price discovery, for example, around a similar theme, which hopefully will simplify some of the process that we've faced on that project. And separately, there's a knowledge sharing platform that Social Finance and the Go Lab, which is Government Outcomes Lab in the UK, and Oxford University sort of initiative with the government, are creating a knowledge platform for the international space. So Go Lab is a platform for the UK space where there's been already a lot of impact funds and some outcomes funds, and we're sort of developing now sort of international development platform to try to share templates on what has been done, to try to share learning, to create a forum where everyone can sort of, share experience, ask questions, such that it becomes a bit easier to then approach new players to sort of for them to get their head around, okay, what does that mean internally for people?
So I will be very brief, just three things. One, I think just solving for investment. And I have been involved peripherally on the social impact bond in Sweden, also around diabetes prevention. And the innovation there has been designed as a regulated financial instrument, very similar to a green bond. So rather than me spending $25,000 and collecting 100,000 travel points, this can actually be issued by a financial institution and press a button. And it comes to the market really as a variable interest rate fixed income product. And so they were able to really spend $12 million in less than 24 hours, which shortens the time frame quite considerably. I think the second innovation that we've discovered, just going back to the quirkiness of outcomes bias, is with our first outcomes mining contract, is we did design a rating card. We segregated the outcomes. So those who wanted to buy, for example, environmental outcome, either energy savings or greenhouse gas emissions, we were able to price and separate that. So in this case, Efficiency Manitoba was only interested in purchasing those outcomes. Others were very interested in purchasing the social outcomes. So we were able to sort of separate those out into 7 or 8 categories. And just the last thing that I think we're really working for is just making sure that the beneficiaries and communities are really staying at the center of this. And the last example I'll give is in relation to Indigenous communities and diabetes. I think our hypothesis going into this was always going to be lifestyle. It was simply going to be related to diet, to exercise. What we discovered through the engagement process is there was a whole range of cultural variants in this. Communities where local Indigenous languages had been reintroduced had significantly lower rates of type 2 diabetes. And so we had to revise our entire approach to this.
Excellent. So we're coming to you in like 2 minutes. So get your questions ready. I just want to turn back and ask Martina and Emily whether you would do this again. We've just started, so this was not even underway, but even the structuring part, interested in that, and whether this is a process you would recommend to people sitting in the room to go through.
I
startups so that we make sure that we can really curb
Yeah, just to be quick, I think we'd certainly look at it again. I think we know that to achieve the SDGs, we need to break down silos and do development differently, as we heard this morning. I think what's interesting for Nutrition International is walking the balance between delivering low-cost, high-impact interventions and also being open to exploring innovative ways in order to maximize that. And certainly the innovative financing space is something we're interested in exploring further in order to achieve that outcome.
Excellent. All right, so just really briefly, a quick round of applause for their initial and then, do we have a mic? Are we putting a mic around, or is it just people to yell? Steve.
Hi, thanks. I'm Steve Mason with Icon Foundation. We have been involved in DIBS from both an investor and implementer perspective. And one of the questions that has really come to the fore in our involvement in these is the question of effectiveness and efficiency versus the very high transaction costs that sometimes these involve. In the situation that was presented here, which is quite a compelling case, it's also true that the people around the table are, in a sense, the usual suspects, right? Grand Challenges Canada and I, your government ministry, are all out there doing this stuff anyhow. So you could argue, perhaps, that you created quite a complicated, lengthy process to do what you may have done anyhow. So I see a strong rationale for DIBS when new money is being brought into the equation where unusual suspects, investors that may not be in this space already, are going to be brought in. When that's not the case, I think we do have to look very carefully about whether we're getting the whether we could have done this quicker and more efficiently. So I guess I would love to hear some reflections on that.
That's great. We're going to take a few questions and then come back to the panel.
I have just a reaction on that point. We're Grand Challenges funded startup, so we use the money to create our impact. So we use that's for example where new peers are coming in. But my question really is like, what type of check size are we looking at when it comes to the financing, and how important is government in the equation? Because Cameroon was involved, but is that really a prerequisite to these types of structure?
We have you over here. I need some help.
Thank you very much. My name is Gerda Burger. I'm the coordinator of the Scaling Up Nutrition movement, and it's exciting to listen to you. And we also want to learn a little bit whether there is something in it for the sub-movement countries, and Cameroon is one of them. My first question is for you, ma'am. How is the government of Cameroon taking ownership after the investment, and when the investments are done to roll out? That's my first question. Second question is to your neighbor from the UK. You were telling it takes a while to build up the contract. Who do you contract? Do you contract people that are in the country, or do you send consultants, etc.? And my third question is to the representative of an eye, and we try to learn in here. What does it take, or maybe also for your neighbor, what does it take to make this bigger? Because indeed we need innovative finance, but then it needs to be attractive and not a model that can only be handled by organizations or by governments that don't have the money anyhow.
Okay, so that's 5 questions. So memories are working on something.
Could you just repeat your second question? It's who do you contract?
That was for your neighbor.
Okay, all right. Sure. In Cameroon, we are presently looking at within the framework of the SDGs, putting in place universal health coverage. Because now we have investors coming, the government also contributing. If we have to really cover the needs of our population, we need to better finance healthcare. And we think that presently, to really ensure ownership and roll out in the whole country, we need to go to universal health coverage, or fully finance healthcare. That's really big.
maybe I'll just add.
So part of the thing that we were interested in on that point is the fact that there's an intensive capital need to get something institutionalized. And so a lot of the recurring costs, once you've done that, are much lower. And so really this development impact fund is getting you over that intensive capital injection, and then the government is able to sustain that with a much better.
Okay, so I felt like a lot of the questions I need to tackle them. So just quickly on the contract. So the main contracts are between the outcomes funder and the investor. And sometimes, if the outcomes funder wants to, they can use their contract template and we'll just work on that. In this case, government or the World Bank hadn't done a deal like that. So we had criminal legal support to create a contract from scratch. And then on top of that, there's then the investor having a contract with the implementer, which is a much more traditional contract, which in this case GCC led on their side. I want to add maybe on the government involvement that it's quite sizable. First, the amount of money that they're bringing, but in addition to that, it's been really interesting to have them as an operational partner. So I don't think it's necessarily needed, but if you think about sustainability, the fact that it's in public hospitals, what we're implementing means that the centers of excellence will be institutionalized and hopefully replicated after that. So now one of the governance structure that one of the governance body actually that we're using is a government technical follow-up committee where the Kangaroo Foundation, Cameroon, the team actually doing the implementation can sort of discuss all those challenges and then what is happening in the hospital with the government, which adds another level to what we're trying to achieve. And maybe I'll tackle the discussion around efficiency versus growth and traditional approach. And I think we shouldn't kid ourselves that impact bonds are not a silver bullet, and they should not be considered as such. And there's a bit of a sweet spot in between. If you know exactly that by doing this list of activities, you're going to end up with X outcome, and just go for one, just put the money into that. If you have no idea as to what activities will get you to the outcomes, then also go with the crowd and just explore it anyway. But if in this case you know sort of what you're trying to achieve, but you don't quite know what the local solution, is required to then achieve the outcome, and I think it's that path to actually scaling it that is very interesting in this case. Then it becomes interesting, and actually when we look at the results during the pilot, although the result in one hospital was really good, the work that has been done in other hospitals that were supposed to be trained also to the pilot were much more mixed because there wasn't data being collected. So first, we don't actually really know. There were a lot of delays. There wasn't that necessarily that rigor and incentive to actually achieve the outcomes. And one thing that I'll maybe mention is that because an impact bond is a bit tricky, definitely this has been a long process, much longer than what we would expect going forward. But it also required an external sort of design partner, so social finance and MOS Design Center for Impact Investing. When organizations do a grant, they actually need to do also a lot of work that is just in the house, and so sometimes that cost is not considered. And I would just want people to consider that as well, because when the woman actually create, for example, the program, it does take at least 2 years to design something. It's just that then the scale could be $100 million when they do implement something. So I think thinking about that scale rather than necessarily trying to do something in 6 months might be a solution.
Certainly, I think as this panel is showing, there has been an incredible amount of learning that has taken place over the last 3 years for us as individual organizations as part of the DIB. Certainly from NI's side, I believe for GCC and the government, that this was a new mechanism that we were testing and trialing. So there was an enormous amount of learning that was happening in-house for all of us. But then also learning, how do we all work together, right? So I think partnership and collaboration is easy to say, it's difficult to do. And so, there was a lot of learning that was happening about how all of us with our own organizations and our own agendas and mandates, how do we come together and work? And I think that we, over this period of time, have become a lot smarter in the way that we do business, both as organizations and as a collective. And so I think moving forward, we would be much more kind of up to speed, and it would be much faster, as Dominique has alluded to, in terms of that contracting process, in terms of the structure, in terms of, you know, knowing how to have those conversations around metrics and outcomes. And certainly talking in terms of scale already as Nutrition International, you know, this has really made us reflect on the grant in, grant out model. And are we actually having the greatest kind of return, both in terms of social, but also financial return for the organization, in terms of taking that forward and looking across our whole portfolio to see whether we could use a pay for results mechanism to incentivize our partners in order to have greater results.
So at the risk of being a reductionist, I just want to get to your question, which is what is it going to take? And I think for myself, having watched how microfinance and later impact investing can scale, a simple answer is it's just evidence. It's data and evidence. But I want to add two more things that we've seen. One is, I think there are still a lot of very difficult questions to answer around public policy and where the legislative responsibility of governments begins and ends. And I'll give you an example in Canada. We have a really interesting social impact bond in Manitoba around the apprehension of infants from Indigenous women. And the question is, should private investors really be the ones that are paying for Indigenous doula services both pre and post birth? Or is this something that really falls within the legislative boundaries of what immigration government should do? So I think that's a really important concept here. And I also think another aspect of this is just around the pooling of outcomes. And I know for ourselves, we haven't talked about the social finance fund in Canada. This is a significant boost to what's going to occur here. And I do think we're going to see a lot more money now coming in through this leveraging opportunity for private foundations. But the biggest barrier is just terminology and nomenclature. Nobody understands what a social impact bond is or what it means. I really prefer just pay for success or some sort of an outcomes or results-based contract, because it's very hard. When you go into a Bay Street office here in Canada and talk about an impact bond, at best, you'll be patted on the head and shown where the fire escape is. I think there's a lot of work to do on it. Thanks.
Okay, we'll do one more round here.
I stutter just like you. My name is David Huber. The entrepreneur. I scared the hell out of my lawyer and accountant, because I am one of the ones who take those risks. I have to say that I can see all the sorts of ways to build businesses out of this. The newborn care model is a business ecosystem. And as an observation, I would like to see some the alliance between the government and hospitals and startup organizations, because I think there's some businesses there. I see your newborn program as a bit like the MP Ms. Fry's example of Gay Cow and how it started, how it started the spin-off center. And I would make the point that your minister's department which is now the world leader in newborn care. And will the government of Cameroon start seeding or expertise around the world, including Canada?
Any other questions?
Hi, my name is with Indigenous International Cooperation. I'm really interested in the sort of value for capturing the impact of this, but I see many applications for the international development. One of the things I'm struck with is the sort of reporting elements and strength of reporting that's built through this, looking at performance indicators. It's very natural and health space to be doing that. It's something that can help us tell the story perhaps in other parts of development. But I am interested in sort of what it means to be building a really strong performance measuring component into our program. There's a cost related to that, one can justify that. But there's to me a question of incentives and incentive potential misalignment, in that you have some costs and partnerships that are very extensive. It takes many years to develop a partnership. And then you have to monitor that performance. And so the incentive to actually find errors, or to the risk that there is to actually undermine that partnership or the investment return. I'm wondering if you could speak to that. How does one ensure that the incentives are done properly in the monitoring of performance?
Good. Any last question? Last chance. Okay, we're going back to the camera. Start us off. Yeah.
The direction I need to you
Great. So in terms of reporting, tracking outcomes, and incentive alignment, I think there's two really important things to differentiate a bit. There's the independent verification of payment metrics, and then there's tracking of operational metrics that allows you to get to the outcomes that are being tracked and verified independently. So in terms of aligning the incentives, I think we took a lot of time, as Emily mentioned before, to actually figure out what is the best metrics such that we minimize the progress incentive, but we also make sure that it's verifiable and measurable, but also and to be as far as possible towards outcomes, not just activities and outputs. So in my mind, the risk of undermining the partnership through that is limited, in that everyone is basically has an incentive for those outcomes to be achieved. It's just that the outcomes funders don't have an incentive to overpay or pay for something that has not been achieved. But we all just want to know, okay, what's actually happening on the ground. And then on the operational metrics, what we ended up doing in Cameroon for this project is setting up a data system and a whole data collection process, because some of the hospitals just not have the data. So when we went there, to understand what the baseline would be, some hospitals, especially the ones that are at the district level, had barely data for the last 2 months. It was really difficult to know just how many premature baby they had, those kind of sort of basic things that we take, I think, for granted in a lot of developed countries. So what we're looking to do, and it's actually sort of being finalized at the moment in Cameroon, is sort of set up a real-time data collection process. We run that metric like in every hospital that's being onboarded, such that we can see how many babies are going through, how many actually die, what's the weight, what's the general sort of pictures in each, such that on an ongoing basis this can be reflected on and then improved upon separately from verifying the payment metric on a quarterly basis. And I think this is the main value of actually paying on outcomes. If you pay on outcomes where you don't have that adaptive management, you just lose the whole value of the impact bond. I think incorporating that, but it's also sort of changing mindset for a lot of implementers, is critical to then get the full value. Not sure that answers fully your question.
Maybe just to add on to that as well, so the indicators that Dominique was referring to are all indicators that ought to be tracked through the national HMIS system, right? So through doing this work, we are actually strengthening the national system, the government system, and that's ensuring the sustainability. And that is at the core of the facility. That's a function that ought to be being done. And so the project is working very closely with the government in order to kind of actualize that. And so, yes, the data is being collected on a regular basis by facility level staff. They are reporting on it. The role of the independent verification agent when they do go in, they'll be going in every 3 months. They'll spend 9 days at the facility. Their role is to verify the data that's being collected, right? So it's really about empowering the facility and really working with the facility to understand that how you collect quality data and then also how you use that data for decision making.
It's like that, this project is one of the things that we're going to have is really the sustainability aspect, because each department in each of us is really, putting what ownership of the various levels. If I take the case of hospitals in Cameroon, will be empowered to be centers of excellence. I mean, they will not take up training of other hospitals, and then we not have any DCC or the other. So we're really ensuring sustainability. Regarding your reflection, sir, I think I really humbly take that as a suggestion, because we hadn't really thought of how, how we could actually play that leadership role. In most of our countries, maternal mortality is reducing, under 500 mortality is reducing, and newborn mortality is stagnating. And as we say, chaos is one of those things that people really carry on, will be able to change the situation. So we'll see how to, after the success that we hope to have, really scale this out nationally, then bring in other countries to see what we're doing, share. There are several meetings where African countries do meet. There's people really need to share and make others, encourage others to do the same. So that's what it is.
Excellent. So we're going to wrap things up, but just to leave you with this arc of a story that is really just beginning. So the concept of how do you pull together really strong kind of seeds of what could happen with the need for still adaptive learning in a context, and wrap it around with a lot of supportive systems and money flowing in the right direction to align those incentives. So we're going to be at this for another 2.5 years at least, and look forward to updating you all as this goes. And like Stephen said, there's really exciting things also happening in Canada, and especially with the launch of the Social Finance Fund. Watch this space, because it's just going to get more exciting. Thank you all for coming this morning.
the event. That was really cool. And I think there's really, like, the panel was amazing. I have to go check out now, but I will be at the booth probably around 2:30 or at 4 p.m. and I'll pack up everything that you need me to. Was there anything else that you need? Just pack up the booth. I think more likely around 4:30 because I'm gonna go to the panel 3 to 4 and then you're flying out. I'll see you.